Today, we're going to jump into the incredible story of phenylketonuria. You'll usually hear it called PKU. And it's a fascinating story, really. It's about genetics, it's about biochemistry, and it's about how one of the simplest medical tests you can imagine, literally just a single drop of blood, can completely rewrite a person's life.
You know, it all starts with something almost every new parent goes through, the newborn heel prick. It's just this tiny little poke, but the secrets that one drop of blood can unlock, they are absolutely monumental. It holds critical clues to a baby's entire future. So what exactly are they looking for in there?
All right, so let's start right there with that incredibly powerful first step, newborn screening.
So, within the first 24 to 72 hours of a baby's life, this screening, often called the Guthrie test, gets done. And it's a huge deal. It's really a cornerstone of modern preventative medicine. See, doctors aren't just looking for one thing. They're screening for a whole panel of rare but very serious conditions that, if you catch them early enough, can be managed. And one of the most important on that list is PKU.
So what is PKU, really? Well, let's use an analogy. Imagine your body's metabolism is this incredibly complex system of highways. With PKU, it's like a critical bridge on one of those highways is just gone. It's completely broken.
At its core, PKU is a genetic disorder that messes with your metabolism. See, our bodies are constantly breaking down proteins from the food we eat into these tiny building blocks called amino acids. One of these is called phenylalanine. Well, in a person with PKU, the body's machinery to process that specific amino acid is broken. It just can't do it.
And the genetics of it are pretty interesting. PKU is what we call an autosomal recessive disorder. Now, what that means is that a child can only be born with it if they inherit a copy of this faulty gene from both parents. Usually the parents are just carriers, which means they have the gene but show no symptoms at all.
So, let's take a closer look at that broken bridge. The whole problem starts because a specific enzyme is missing. It's called phenylalanine hydroxylase, or PAH. Now, the job of this enzyme is to turn phenylalanine into another amino acid called tyrosine. Without PAH, that conversion just doesn't happen. So phenylalanine starts to pile up in the blood, like a massive traffic jam. And here's the really dangerous part. That overflow eventually crosses the blood-brain barrier, and there it becomes toxic to the developing brain.
And this is where the story gets really urgent, because that toxic buildup doesn't happen all at once. At first, it's completely silent. You wouldn't even know it's happening. Just look at the difference here. In the first few months, the signs are so subtle, so easy to miss. Things like vomiting, being extra irritable, maybe a skin rash. You could mistake it for a dozen other things. But if it goes untreated, the consequences are, well, they're devastating and permanent. We're talking severe intellectual disability, developmental delays, seizures. That silent buildup becomes a roar. You know, there's actually a memorable little mnemonic that doctors sometimes use to remember two of the classic signs. Because phenylalanine can't turn into tyrosine, and tyrosine is a key ingredient for making melanin, the pigment that gives our skin and hair color, kids with PKU often have very fair skin, light hair, and blue eyes. And as the body tries to get rid of all that extra phenylalanine through other routes, it creates byproducts that give the urine a very distinct, sort of musty odor.
Okay, but this is where the story takes a huge, hopeful turn. Because of that single drop of blood from the very beginning, we can decode all these clues long before any permanent damage is done.
It all comes down to this number. Now, a normal phenylalanine level in the blood is less than 2 milligrams per deciliter. The big red flag in a newborn screening is any number higher than 6. That single number is the trigger. It kicks off the next steps and completely changes the course of a child's future.
Of course, doctors don't just rely on one test. A positive screening always leads to more definitive tests, to be sure. They'll do more blood work to confirm those high phenylalanine levels, and a urine test will show those byproducts we mentioned, the phenylketones, which is actually where the condition gets its name.
So, the diagnosis is confirmed. How do you treat it? Well, this is what's so amazing. The answer isn't a pill, it's not a surgery. It's a very specific, lifelong plan where food itself literally becomes the medicine. The entire strategy is just to severely limit how much phenylalanine a person eats. And that means avoiding all high-protein foods. We're talking milk, eggs, meat, fish, cheese, nuts, soy. Even the artificial sweetener aspartame has phenylalanine in it. It is an incredibly restrictive list of foods.
So you're probably thinking, what can they eat? Well, the diet is mostly built around fruits and vegetables, plus some specially made low-protein foods like bread and pasta. But the real hero of the diet is a special medical formula. It provides all the essential amino acids their body needs, except for phenylalanine. They also have to take tyrosine as a supplement, because remember that broken bridge? Their body can't make it, so they have to get it from their diet.
And I really have to emphasize this is not a diet you go on for a couple of years. It is lifelong. It takes constant attention, from reading every single food label to getting regular blood tests to make sure those phenylalanine levels stay in a safe range. It's a huge commitment.
When you zoom out and look at the big picture, the story of PKU isn't just about a medical condition. It is honestly one of the greatest public health success stories of our time. It is a truly preventable tragedy.
I mean, the two possible paths could not be more different. They're like night and day. On one side, the untreated path leads to severe, irreversible brain damage. But on the other side, with that early detection and a strict diet, a child with PKU can have totally normal development, grow up healthy, and live a full life.
So the takeaway here is simple, but it is so profound. That tiny drop of blood, that simple Guthrie test, it's a shield. Every single day, all around the world, it prevents the devastating consequences of this disorder, allowing thousands and thousands of kids to reach their full potential.
The success of PKU management is a huge win for science, but it's also a testament to the incredible dedication of the families who navigate this diet for a lifetime. PKU was the pioneer. It proved the unbelievable power of newborn screening. And that leaves us with a really exciting question for the future, right? As our understanding of genetics just keeps growing, what's next? What other conditions are out there just waiting to be turned from a devastating diagnosis into a manageable one? All thanks to the secrets hidden inside a single drop of blood.